Today's guest is Derrick Drouillard, Executive Director at the Windsor-Essex Children's Aid Society. Derrick, welcome to today's show.
Great to be here. Thanks for having me.
How are you and your family doing during this interesting times?
Yeah, I think probably similar to many folks, just trying to do our part to flatten the curve and be socially responsible and find interesting ways to stay entertained and to cope through the chaos. And so it's actually been going okay. And I think, my son just finished first year university at Laurier, so he's been quite busy finishing his exam. So he's been busy. My 14-year-old daughter, on the other hand, who's quite a social butterfly, is finding this very difficult to be away from her friends.
How has COVID-19 affected you and the operation at the Children's Aid Society?
Yeah, we have certainly had to modify our operations, and for a number of reasons, and certainly to keep our staff and their family members and their loved ones safe, to ensure that our families that we serve, the children, youth, and families that we serve, are safe. And so we've reduced our normal course of face-to-face contacts that we would have with families, and have done a very good job in trying to be connected to families in very different ways, virtually, by phone, by contact through email and other methods, by some social distancing visits with families. And certainly the more serious and urgent cases require face-to-face contacts, and so we are continuing to do those. And so it is a modification of our service. We've locked our building down, and most of our staff are working remotely, and so we are continuing to provide the service, just in a very different way.
Okay, you talked about possible face-to-face interventions. If they're required, what procedures are in place?
We have developed, using, of course, the best and most up-to-date information from public health officials around screening and self-assessment questions for our staff and for those families that we will see face-to-face. And we've developed our protocols. We have a very robust and active Joint Health and Safety Committee at work, who are also working around the clock to ensure the safety and well-being of our staff, who've updated our policies and protocols. So we feel comfortable with the level of policies and the processes that we put in place to ensure safety to the best extent possible.
Schools are now closed until the end of May. How will that impact your services?
Schools and other social service organizations are our number one referral sources, and so we are great partners with all the school boards in Windsor-Essex, and whenever they have a concern for a child, they are calling us, whether it's cases that we are currently working with or new situations that they're worried for a family or for children. And so the fact that the schools are closed certainly decreases the referrals that we've seen over this COVID period. And also we know that many compromised families who may have some additional stresses and challenges in their lives look towards schools and other programs to be a bit of a safety valve for them when the stress is high and coping is difficult. And so without having also that sort of release valve so that kids can continue on to be receive education and have other eyes on them, we know that that increases the stress for families. Schools are great partners. They're eyes on children more often than we are, and so our reliance on them is high, both for identifying cases where they might have concerns and for continuing to monitor kids on an ongoing basis.
Are you working with other community service providers to assist the families?
We are. We partnered with a number of service providers, including the United Way, including the food banks, including the Food Security Coalition, that a number of our volunteers who would normally be bringing children for visits with their families, and if we're doing most of that virtually, some of our volunteers have then joined the United Way's food security outreach and are delivering food packages and things to vulnerable families in the community. So we continue to be in close contact. We're also a a member of the Prosper Us Committee, which combines a number of organizations in the community, continue to work with supporting vulnerable communities and families in Windsor-Essex.
If anyone has any concerns about the safety or well-being of a child, what should they do?
If you have a concern, please call us. We are not closed, and I think there's some confusion out there whether we've closed our services. We have not closed, and we are open and ready to receive referrals or concerns. People can call us at 519-252-1171, and you will be prompted to, if you have a concern for a child or a family, to dial the number and the extension, and you will be connected with a live body. And also, you can forward a concern to our website. You can look at the website to get the information at www.wecas.on.ca. If you have a concern, please call us. And I think what the community needs to be aware of, 90% of the children we serve are not in our care. They're with their families in the community. And when families are under difficult circumstances, they need our support and help. You add in this pandemic, which has really increased the stress and challenges. And I know a number of families could use our support. And so please call us.
Great. Just lastly, there's stress all over. Everyone is, the families, the children, but also your staff. How are your staff handling all this stress going on at this time?
Yeah, our staff have really come together in a great way. They're being flexible and willing to do whatever it takes to support families. They've been creative. They've helped each other. The stress is high. We're considered an essential service, and so we have to provide our mandate, and staff know that. And so, we've been able to provide a number of items for staff in terms of face-to-face PPE requirements. But that still is a stressful situation for them. But we have an amazing group of staff here, and so I'm just so fortunate to be part of an organization where I see our staff really coming together, understanding that there are people in our community who still need us.
Well, this is a real time of appreciation. Earlier in the show, I mentioned Doctors' Day, but to your staff, in helping our community, helping the children, please accept our heartfelt appreciation. And lastly, we always ask this question: what are you looking forward to when this is all over? When we get into some sense of normalcy?
Yes, so much. You know what? I like to be spoiled out with a dinner somewhere, and so I'm looking forward to going out to a restaurant and being waited on and not having to clean up afterwards. And so I really look forward to taking my family out for a nice meal.
Well, thanks, Derrick. Thanks. And once again, our appreciation for all you do and your workers do there. Thanks for coming on today.
Thank you so much. I appreciate your time.
I was Derrick Drouillard, Executive Director at Windsor-Essex Children's Aid Society.